Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here to talk a little bit about azithromycin. We're going to talk about the 250 and 500 milligram tablets, um, the common dosages, usage, and side effects of this medication. First up, what is azithromycin? It's an antibiotic in a class of antibiotics called macrolide antibiotics. In the US, it's sold under the brand name Zithromax, or also available in the tri-pack and the Z-pack, extended release suspension called Z-Max, and then an ophthalmic preparation or an eye drop called Azicite. What infections is azithromycin used to treat? Now, it's important to realize just because the infection you may have is listed on this list, your healthcare provider may determine azithromycin is not the best treatment option because they're going to have access to data in your area showing resistance to certain antibiotics, whether it's appropriate, or they may even get a culture to determine the best antibiotic treatment for your infection. So that's why you just because your infection is listed on here doesn't mean azithromycin is going to work for that. So your healthcare provider can determine whether that's appropriate, and they can determine whether you have bacterial infection. The CDC estimates at least 30% of antibiotics are unnecessary for the infection, and taking antibiotics when not needed, that can lead to resistance, and that's not good for all of us because it's going to over time reduce the effectiveness of the available antibiotics. But common infections used to treat with azithromycin include bacterial sinusitis, COPD exacerbations, chronic obstructive pulmonary disease brought on by bacterial infections. Pneumonia, community-acquired pneumonia, meaning you didn't get it when you were in the hospital. Otitis media or ear infections. Again, that one is dependent on the type of bacteria the doctor believes or the healthcare provider believes is causing the infection. Gonorrhea, staph and strep infections can be susceptible to azithromycin. It's sometimes used for traveler's diarrhea, bacterial endocarditis. That's a serious infection of the heart. The ophthalmic preparation can be used for pink eye. And there are many other infections that can be used with azithromycin. Your healthcare provider can determine whether it's the appropriate treatment for you. What's the usual dose? Well, the tri-pack is a 500 milligram tablet, and it's just taken once a day for 3 days. Z-pack, in the area where I practice, is by far the most common. You take 250 milligram tablets the first day, so 500 milligrams the first day, followed by one a day for 4 more days. Treatment for STD is often a 2-gram one-time dose, which any 1 to 2 grams depending on the infection. So that could be 2 to 4 500 milligram tablets one time, or the Z-Max suspension. And other treatment regimens, depending on the infection, sometimes daily for chronic infections. We don't see that very often, but these are by far the most common doses that we see. How do you take it? With or without food, although most people do best with food because that can reduce the stomach upset. Except for the suspension, the Z-Max suspension, that is recommended on an empty stomach. So we're talking an hour before eating or 2 hours after. Common side effects. Most common we see diarrhea, nausea, vomiting, and stomach pain. Taking it with food really reduces a lot of those. As a whole, it seems like most people tolerate it well. Some people with sensitive stomachs lose that dose, they vomit that up, and if you can't keep it down, you may have to talk to the provider about an alternative treatment. Not very common though. Most people with a little bit of food can tolerate it. Less common side effects, headache, chest pain, or heart palpitations. It can affect the heartbeat sometimes. It's pretty rare, but it can. Dizziness, drowsiness, headache can occur. Rash and itching. Yeast infections that can happen after antibiotic treatment. Increase in liver enzymes can sometimes be seen, as well as others. Rare but very serious side effects. We can get a severe rash, and if you have a severe rash, you know it. It's the whole body really bad, requires immediate medical attention. Again, it's extremely rare, but we just need to be aware of these things. A regular heartbeat. So especially if you're already have some heart issues, this should be used with caution because it can affect the heartbeat or the heart rhythm. Hepatitis, so it can have some effect on the liver. If you already have some liver issues, that's a conversation with the doctor to determine whether it's appropriate or we just kind of monitor for it. And there is a very small risk in increase in cardiovascular death after using azithromycin. Um, so that, again, it's super rare, but it's been noticed, so we do warn about it. If you are worried about that, be sure to talk to your doctor because, of course, you can die from infections as well. Everything in medicine and life is a risk benefit. So if you're at all concerned with that, be sure to chat with your doctor. Interactions, as we kind of mentioned with the heart, it can affect the heart rhythm. So any medications you're taking for heart rhythm, like amiodarone or any of those other heart rhythm medications, those can be affected. So that goes into determining whether azithromycin is the appropriate treatment for you. It can increase the risk of certain side effects with statins. So keep that in mind if you're on the cholesterol therapy for statins. Chat with your doctor or pharmacist if you're concerned about that. Digoxin toxicity. Digoxin is another heart medication, and the azithromycin can alter how it's processed in the colon, increasing the levels of digoxin in the body. Increased risk of bleeding with warfarin. Every medicine seems to affect warfarin. This doesn't mean that you can't use the two together. We do see it used together sometimes. You just have to be aware of the risk, and then oftentimes your doctor will just have you come in for labs after you finish it, make sure your numbers aren't completely out of whack. I appreciate you watching. Make sure you always speak to your doctor or pharmacist. If you ever have questions, concerns, you think you're experiencing side effects, the sooner you notice that stuff, the sooner you let your healthcare provider know, the less likely it's going to have a bad outcome. And if you appreciate the information I provide, I'd love it if you'd subscribe to my channel. And again, thanks for watching.